Midfoot arthritis occurs in the middle of the foot, and the midfoot is typically this area right in the center of the foot where the middle joints occur and at the top of the arch. And when midfoot arthritis occurs, it is loss of cartilage in those joints of the middle foot, and it can occur anywhere throughout the middle of the foot. The most common place is at the second joint or at the base of the second metatarsal in that very top edge. You'll know that you have midfoot arthritis if you have several things. If you have swelling that develops that doesn't seem to have a reason around the middle part of the arch, pain through that area, and it's usually felt on the top of the foot, not so much on the bottom, but can be felt in both places. And then also, if you notice that you have pain as you try to roll off of the foot during walking, so during the phase of toeing off or rolling off of the foot, you notice that pain seems to radiate up and down the middle of your arch, you may have midfoot arthritis. Midfoot arthritis is common in people that have had bunions for a long period of time, had prior trauma to the foot, or twisted the foot significantly during sports injuries or some type of an accident in the past. And sometimes it's genetic, and probably the most common situation is in genetic arthritis. This can occur anywhere from the mid-40s all the way up to the end of life, and is very uncomfortable, and in most cases will need to be treated in order to make it better. Sometimes the pain comes on and then it gets better over time. But if you've noticed this and it hasn't gotten better within a short period of time, you can treat this on your own at home. The initial treatments that you would do at home would be to go to a rocker sole shoe, and there are many manufacturers now that manufacture a shoe that has a natural rocker sole. This has been, in my experience, one of the most effective ways to treat midfoot arthritis, because it allows for the foot to naturally roll without bending through the middle of the arch, and so it doesn't put stress on these joints that have started to develop spurs and loss of cartilage. In addition to a rocker sole, an over-the-counter or custom orthotic or footbed can be really helpful. The FootMind orthotic line has a very nice neutral orthotic, and in some cases a tilt orthotic to different directions that can show or they can correct the deformity and support the middle of the arch. If these things aren't effective, then an additional thing you can always watch for is enough room in the shoe, and be sure to avoid laces that cross over any spurs that you may find. Sometimes a spur will occur right across the area of the midfoot, and if a shoelace crosses that area, then that shoelace, when tightened, will cause friction pressure and pain. And so skipping the eyelets in the shoe and allowing for a space to occur on top can take pressure off of that area. In addition to these things with shoe changes, at home you can also use anti-inflammatory medications, including the use of Motrin, ibuprofen, Aleve, naproxen. Tylenol can be helpful as well in reducing symptoms, or acetaminophen as the generic term for that. Anti-inflammatory gels massaged into that area can also reduce pain and have been very effective in my experience in making midfoot arthritis feel better. Modification of activities, reducing the activities that cause the pain, will also reduce your symptoms. But if you become less active and your general aerobic conditioning deteriorates, then this really needs to be treated. If you're not able to manage these symptoms at home, then you should see your doctor for this. And the period of time for management, I think, would be around 3 months that you could manage this from home before deciding to have this pursued. If after that period of time you're not better, then your doctor will see you and will obtain x-rays to confirm the presence of arthritis across the middle of the foot, and then also look at your feet with an examination to determine whether any deformity is developing or whether there are other conditions that might be associated with this that could be corrected to help you. Your doctor may also prescribe some pharmacologic or pharmaceutical strength gels that can be massaged into the area of symptoms, and also may prescribe a custom orthotic, one that's molded for your foot specifically to reduce the pain that's coming from this area. One of the next most important, well, relatively important treatments that your doctor will also often recommend is the use of cortical steroid or steroid injections. And those injections can be targeted directly at the joints of the midfoot that are most arthritic or most painful. And in my experience, these injections can last anywhere from 3 months up to a year and reduce pain, and can be a good temporary treatment for midfoot arthritis. In addition to these things, sometimes if it's very significant, you can also have the use of a brace or a custom type device that locks up the foot a little bit more and reduces the symptoms. Once these things have all been tried and are ineffective, then again surgery becomes the most effective way to permanently fix midfoot arthritis. Surgery involves typically fusing the joints that are deformed and that are diseased, and that fusion will often occur by opening up those joints, breaking up the surfaces, and then fixing them together, sometimes with bone graft, connecting them with plates and screws. And there are several companies that make designed plates and screws to fix these areas and make it a very good construct so that the fusion will occur. If you have a fusion of the midfoot arthritis, you will require probably 6 weeks of no weight bearing on your foot and probably 3 months of recovery time before this is completely healed.